do the palpation and the work, okay? Instead of palpating while they're sitting, it's way easier to use the weight because then you can feel first right up their spinous process, and then you can also feel transverse processes very easily. So you can look for your facet dysfunctions or anything like that. Sorry, my hands are cold. So what I usually suggest for any student is come below their shoulders, find that C7, that really prominent guy, and then come up on spinous process. How many spinous processes should you be able to palpate? From C7 all the way up. How many spinous processes? 5? 6. We want to go with 6. Which one does not have a spinous process? C1. Okay? And then you want to come all the way up and hit into your occipital ridge. Okay? Then when you hit occipital ridge, you want to come out just like one finger width, and then you can go back down and start with transverse processes and hit right into transverse processes. If you don't feel comfortable, you can start at C7. Again, come out slightly, you'll hit rib, and then you can come up. What I suggest is when you're feeling transverse, almost hit them and then oscillate between the two to feel depth. Okay? Because there will be a difference, especially if they're having cervical issues or tightness. So right away I can say that his whole left side is tight and he's slightly rotated in his facet palpation. I already know that just by feeling him. Okay? Most people, scalenes attach where? Scalene muscles. Yes, that's where they are, but what specific cervicals? Are they on transverse or are they spinous? Transverse, and they're 3, 4, 5. I think 2, 3, 4, 5. I could be wrong. But they're right there on the transverse. So if you have any scalene issues, they're going to cause dysfunction in the cervical spine. Okay? Then where do they attach?
Down to the clavicle.
They go kind of not near they go near the clavicle, but not clavicle. They're on rib 1 and rib 2. Okay? So if you find those transverse processes in the muscles, then you can palpate down that muscle belly and then hit in to that first rib, and you can hit in to the back rib. Okay? And that's the easiest way to kind of find those major landmarks. Okay, so you can palpate down, first rib, second rib. When you hit first rib, if you can find it on both sides, have them take a deep breath and feel the first rib movement. In and out. They should move. If they don't move, they're stuck. Okay, and that will be important when we start doing our nerve tests. Okay? Because first rib will have a big impact on a lot of your thoracic outlet stuff and your nerve stuff. And especially scalenes will also have a big important part because that whole complex runs through your scalenes. So if your scalenes are really tight, they can add compression to the nerve compartment. Okay? If the first rib has dysfunction, it can add compression to the thoracic. If you have a cervical rib, it can add compression to the thoracic outlet. Okay? So getting comfortable with palpating those small areas is really important. Okay? The next test we're going to do after palpation is we're going to do this lovely vertebral artery stress test. So this is a really fun one because people pass out. But don't let your friends pass out, okay? Just check in, and if they get lightheaded, just stop the test. So you have the person, yeah, it's fun. Bring them off the table. Have their hand in your head, or their, yeah, head in your hands. You're going to extend and rotate, and then hold them there for about a minute. If they get lightheaded or start to pass out, that means you've stressed the vertebral artery, and that's bad. Okay? You can go back on the table. Questions?
Yeah. So, like, what is it? You're stressing the vertebral artery, but
Yes, because you're extending it right here on the opposite side.
okay.
So you're limiting the blood flow to his head. So you're either extending it or compressing it.
So then what are you looking for?
Them to get lightheaded and pass out.
But then like what's the pathology that you're testing?
So you're testing if they're either tight or have an impaired blood flow to their head.
So they shouldn't get lightheaded.
They're gonna get lightheaded and pass out.
Either way.
Yeah. I've never had a positive, but they tell me to test this every time you do massage on the neck or traction.
I don't know if it's positive.
They get lightheaded and pass out.
Oh, but you've never had one?
No,
Okay.
I've never had a positive case.
So negative, they wouldn't.
So negative, they just hang out here for a minute and then we put them back on the table. Does that make sense? So positive is they get lightheaded and pass out. If it's negative, nothing happens. Okay? Go palpate. And what you can do is go spinous process, find the transverse process, so specifically somebody that has a rotation or has a difficulty with their rotation, okay? Find transverse process. Let's say whatever level you think that they have issues. You can have them flex. So flex your head, not your shoulders. You can have them rotate. And then you can also have them laterally bend away or into it. If you have them into it, you're going to close that facet. And you're opening this facet. So you're looking for the facets not moving correctly. Okay, this is the only way to test facet movement. Does that make sense? So you can also have, so just remember how you have the movement. So if this is your spine, okay, as soon as they flex, they're going to open up the bottom facet, right? As soon as they rotate away, they're now opening this side and closing this side. When they laterally bend, then you're really closing this side, you're really opening this side. So if you want to see if the neck is moving correctly or not moving correctly, this is the way to tell. You can also have them extend completely, then rotate to the side to again close the facet and see if there's a dysfunction at that facet level, okay? So it's similar to like range of motion in the back, why we do the slump test with the leg extended and a rotation, because we really want to see if we can occlude one side or the other side. Make sense? So that's one way to test for that. Then if we're looking at doing different tests while they're seated, we can do Spurlings and modified Spurlings. So Spurlings is to test if there's dysfunction in the facet, but it's also to test if there's a disc or a nerve dysfunction, because we're going to apply compression to it, okay? So basically you have an individual, you put your hands on their head, and you press down and load the C-spine, okay? Super not comfortable, really fun to do. Modified Spurlings is the same thing, only now we're looking to really close a facet. So the same concept, and we're not looking at a specific facet level, okay? So we're going to extend, and we could do the pressure here. We can extend and rotate and get pressure, or we can extend, rotate, and laterally bend and load him. And all of that is to look for facet cervical dysfunction or issues with a nerve root at that level, okay? You're looking for pain at that level. You're also looking for pain that's radiating, okay? Does that make sense with Spurlings? It's not my favorite test. I prefer not to do it, only because it just is uncomfortable as the patient. So I prefer the palpation method, but again, use what you have. It's a good test because you basically piss off the facet, okay? If you have them lay back down, you can do cervical traction or cervical distraction. So you can do the same thing of compression, either seated or laying down. So again, you can load his head this way. And then you can also do a traction. So you can grab at the occipital and pull and see if that opens everything up and relieves his nerve pain. The other option you can do is another type of traction, which I like better because it's a little bit easier, less work on my hands. Hand up, lace it through, rotate, and then add a little bit of pressure if you need, and that will add traction. Okay, the only bad part about that when you're looking at tests is it will add some compression back here. Okay, so if you have like tenderness with palpation up your cervical spine, then you're going to want to hold occipital to test. But if they're not having pain with palpation as you work up, you can easily try to just do this type of traction and see if that alleviates the symptoms down the chain. Does that make sense?
Yeah.
Okay. Do you want to go through more tests, or is that enough for right now?
Enough for now.
Enough for now. Practice